Ever feel like you buy those bright, vibrant fruits and veggies with the best intention, only to find them, I don't know, they're turning to compost in record time while that bag of chips in the pantry remains stubbornly crispy?
Yeah, I think we've all been there.
You're definitely not alone in navigating these everyday consumer conundrums here. Today on The Deep Dive, we're unpacking that and a whole lot more.
Welcome here on The Deep Dive. Our mission is pretty simple. You give us the sources, and we try to extract the key insights, making you the most informed person at the virtual water cooler.
Exactly. And today's information feast comes courtesy of consumers.app. Just yesterday, May 25th, 2025, they put together this really fascinating snapshot of consumer news and trends. They're calling it Consumers 360 News Commentary.
Right. And we're also going to be digging into some analysis from Consumers Research. They've got some great questions and, importantly, some practical answers on these topics.
Yeah, what's striking about this collection is how interconnected seemingly different bits of our lives as consumers really are. I mean, we'll be journeying from the potential disappearance of the penny.
That little copper disc we barely noticed.
Right, all the way to like the vital role of life insurance as we live longer, the global resurgence of traditional medicine, AI's influence on our health.
And even how plant-forward diets impact managing diabetes. It's quite a mix. Prepare for some maybe unexpected connections.
Okay, let's dive into something fundamental then, the stuff that jingles or maybe doesn't in our pockets. WGAL News brings us the headline. So what happens to America's 114 billion pennies once the U.S. stops making them? It feels like we might be witnessing the slow fade of this coin, doesn't it?
It does seem that way, yeah. And Consumers Research has been thinking about the ripple effects. One of their first questions looks at retail innovation, how businesses are preparing for a penniless future.
So what are they seeing?
Their analysis highlights a few key shifts. We're seeing a faster embrace of digital payments, think tap to pay, mobile wallets becoming even more common, self-checkout lanes, probably becoming the norm.
Okay.
And then there's this idea of round pricing, where cash transactions just get adjusted to the nearest nickel.
Round pricing. So if my total is like $10.01 or $10.02, I'd just pay $10 in cash.
That's the basic idea, yeah. It simplifies cash handling a lot for retailers, and it really just highlights this broader digital shift happening in retail. It's all about efficiency and convenience.
Right. But does it change how we spend, without the small change?
That's a good question. It might subtly alter how we think about value. Consumers Research also asked about other countries like Canada, Australia, New Zealand. They got rid of their small coins.
And what happened there? Any chaos?
Actually, no. The experiences seemed largely positive. The transition was pretty smooth, minimal disruption. They adopted rounding rules for cash, just like we discussed.
But electronic payments stayed the same.
Exactly. No effect there. Consumers adapted quickly, and businesses actually benefited from lower costs, handling all those coins. And it didn't seem to mess with overall prices much, which is usually a big worry.
Okay, so if the U.S. does ditch the penny, what are the economic effects we might expect in retail? Consumers Research looked into that too.
They did. And their analysis suggests, several potential benefits. The government would save a chunk of money each year because, it costs more than a cent to make a cent.
Right.
Retailers would likely see lower costs for handling cash counting, sorting, banking, all that small change. And the thinking is that rounding cash purchases would have like a negligible effect on what consumers actually spend overall.
So potential savings all around, maybe.
Could be. Those savings could then go elsewhere, maybe fuel more innovation or lower other costs.
Makes sense. Now, let's zoom out from the penny a bit and look at the bigger picture of how we shop. Consumers Research asked about how digital tech is reshaping retail and driving new consumer stuff.
Yeah, this is where things get really dynamic. Digital tools are fundamentally changing things. We're seeing hyper-personalized shopping experiences, retailers using data to guess what we want.
Like magic recommendations.
Sort of. AI is optimizing inventory, making sure stuff is there when we want it. And this whole omni-channel thing moving smoothly between online and physical stores, that's becoming standard.
What else? Like AR try-ons?
Exactly.
Yeah.
Using augmented reality on your phone to see furniture in your room, or walking into a store and paying without ever seeing a cashier. It's all about making it seamless and tailored to you.
It really feels like the digital and physical worlds are merging, but who's making all this happen behind the scenes? Consumers research touched on information brokers and data privacy, too.
Oh, absolutely. Information brokers, often big tech platforms, are key connectors. They analyze tons of data about us to match us with retailers. But yeah, that raises huge questions about data privacy. How they handle our info really impacts competition. And, maybe more importantly, our trust. Research suggests stronger privacy rules could actually hit smaller retailers harder, the ones who rely on these platforms. So there's a real tension there.
Finding that balance between cool, personalized stuff and, well, our privacy.
Precisely. And speaking of disruptions, the pandemic really shook things up in retail. Consumers research looked at how COVID spurred innovation and this idea of supply chain resilience.
Right. Everything went online overnight, it felt like.
It was a massive accelerant. Retailers had to scramble, huge shift to e-commerce. Contactless delivery became essential. We also saw pushes for more flexible supply chains.
But did it actually fix the underlying problems?
Well, studies, like one on the UK food supply chain, showed resilience, yes, quick pivots, more collaboration, but there's still this sense the system is kind of stuck in a rigidity trap, meaning we adapted, but maybe more fundamental changes are needed to really future-proof things.
Interesting. It's fascinating to think how we even got here. Consumers research looked back at the history of retail innovation, too.
Yeah, briefly. If you trace it back from peddlers and local markets to department stores and now these huge digital marketplaces, it's a long story of adaptation.
Always figuring out what to sell, how to display it.
Exactly. The core questions haven't changed that much. But what's different today is how deeply digital is integrated. It's all about that seamless omni-channel experience and using tech for personalization, constantly adapting.
Okay, let's shift gears a bit. Something top of mind for many, especially as we live longer. Retirement planning. This is money, had a headline that really makes you stop. Wealth experts reveal exactly what you will have to save even if you live to 100.
Wow, it's a stark reminder, isn't it?
Mm-hmm.
And consumers research dug into that critical question, just how much does a UK retiree need to save to avoid running out, especially if they hit 100?
So what's the magic number or the scary number?
Well, according to the Pensions and Lifetime Savings Association, for a moderate lifestyle, a single person in the UK might aim for about £23,300 a year. For a comfortable one, it jumps to around £37,300. Now, translate that to someone retiring at 66 and living to 100. You're looking at needing a total pot, somewhere between roughly £800,000 and $1.3 million.
Wow.
And that's factoring in the state pension and inflation, assuming no other major income or expenses. Yes, substantial.
It really is. And with more people hitting 100, like that article mentioned, what are the demographic shifts? Consumers research looked at this.
Yeah, the UK is definitely seeing a big shift. Projections show a huge increase in centenarians, maybe from around 16,000 now to like 110,000 by 2035.
Why the big jump?
Better healthcare, better living standards, medical science, all contributing. But the challenge for planning is making sure savings and pensions actually cover those extra years. It really ramps up the pressure to save earlier and save more.
Right. And speaking of pensions, consumers research clarified the difference between defined benefit and defined contribution plans. It's easy to get lost in the jargon.
Totally. So, defined benefit, that's the more traditional kind. You're promised a specific payout for life based on salary, years worked, like a guaranteed income. The risk is mostly on the employer or fund.
Yeah.
Defined contribution, much more common, now relies on your contributions and how well the investments do. Here, the risk investment ups and downs, living longer than expected, is mostly on you, the individual.
So that shift really puts the onus on us to plan better.
Exactly. It makes proactive personal planning way more critical for long-term security.
So with longer lives, should we rethink when we retire? Consumers research looked at recent studies on the optimal retirement age.
Yeah, recent research from 2023 suggests that, well, delaying retirement can be a smart move for many as life expectancy rises.
Makes sense, more time to save, fewer years to fund.
Precisely. It eases the strain on pension systems and lets individuals build a bigger nest egg. We're even seeing talk about hybrid models, sharing risk across generations, and more flexible retirement ages to match reality.
Okay, so once you are retired, how do you best manage the money? Consumers research looked at investment and spending strategies.
Right. A 2024 study suggests a good strategy involves balancing your portfolio, making sure you have steady income, but also staying flexible about when you actually retire.
Adaptability seems key.
It really is. The research stresses having investment strategies that can change and being ready to adjust your spending based on the market and your own situation. It's about constantly checking in and tweaking things.
Retirement planning sounds like it's getting super sophisticated. Consumers research even mentioned intelligent agents and deep reinforcement learning. Sounds like something out of science fiction.
It is pretty cutting edge. Recent academic work is actually exploring using these advanced AI techniques to create really personalized retirement plans.
How so?
These models can analyze tons of factors: your income path, career changes, future growth potential. The goal is to build tailored saving and investment plans that can automatically adjust to life changes and market swings, trying to boost security and lower the risk of running out of money later on.
Fascinating stuff. Okay, moving to another financial angle. MoneyWeb asks a really relevant question. Do I still need my life cover in retirement? Maybe not something everyone considers.
It's a really valid question. And consumers research explored the main reasons retirees might actually still want or need life insurance.
So what are those key reasons? Why keep paying for it?
Well, it often boils down to providing security for dependents, maybe covering outstanding debts like a mortgage, dealing with potential estate taxes, or simply wanting to leave a financial legacy.
Okay.
So if you still have significant financial obligations or people relying on you, it can be crucial. But if those things have reduced or gone away, maybe the need isn't as strong. It's very much an individual decision.
What about the costs? How do the fees on life insurance or annuities affect that decision? Consumers research looked into this.
Yeah, recent research suggests that the cost, the loads and fees can reach a point where holding on to them, especially later in retirement, becomes less appealing.
So the cost outweighs the potential benefit.
Potentially, yeah. One study indicated that realistic fees could significantly reduce demand for life insurance among older retirees. Their focus might shift more towards ensuring they have enough income for themselves rather than leaving a big payout. It really highlights why you need to check if it's still cost-effective for you as your situation changes.
Makes sense. And how much does just understanding finances, financial literacy play into these decisions? Consumers research mentioned a study on Japanese households.
It's interesting that 2024 study found that being more financially literate didn't automatically mean people did more retirement planning or invested more.
Really? Why not?
It suggests that while understanding money is important, sure, other things matter too, like motivation, cultural attitudes towards planning, and whether suitable products are even available or easy to access. So literacy is just one piece of the puzzle.
So how do retirees find that sweet spot, balancing income, enjoying life, and having the right insurance? Consumers research looked at scholarly work on this.
Yeah, recent academic work suggests the ideal strategy involves really thinking through your income needs, what you want to do in retirement leisure activities, and your comfort level with risk.
Is there a tipping point?
The research even points to a potential income threshold where retirees might decide, okay, I'm going to postpone retiring. Or maybe I'll reduce my life insurance because I want to prioritize enjoying retirement now. Again, it's super personal.
Are there alternatives to traditional life insurance for retirees? Consumers research looked into that.
Yes, definitely. Annuities can offer a guaranteed income stream. Just plain old savings and investments can provide income and be passed on. And there are newer products like variable annuities with certain riders that mix income generation with some insurance-like protection.
So options that might be cheaper or fit better?
Potentially, yeah. Worth exploring if traditional life insurance feels less relevant or too expensive later on.
All right, let's pivot now to something quite different in global health. The Week had this headline: AYUSH moves into global healthcare mainstream with WHO collaboration. What it means. Okay, first off, what is AYUSH?
Right. AYUSH is an acronym for the traditional and complementary medicine systems practiced in India. It stands for Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy.
Got it. And this collaboration with the World Health Organization sounds pretty significant. What's the main goal? Consumers research looked at the implications.
The main goal is really to help integrate these traditional Indian systems into mainstream global healthcare. The partnership could lead to standardized protocols, more international recognition for therapies like yoga, aligning them with global frameworks.
And it fits with broader WHO goals.
Yeah, it strongly aligns with the WHO's Sustainable Development Goal 3, Health and Well-Being for All, by promoting a more holistic, sort of pluralistic approach to healthcare.
How might this integration help specifically within India with its healthcare challenges? Consumers research looked at AYUSH and preventive medicine.
Integrating AYUSH with preventive medicine is seen as a way to tackle India's complex quadruple burden, managing chronic diseases, fighting infectious diseases, improving maternal-child health, and handling an aging population.
So AYUSH focuses more on lifestyle.
Exactly. Lifestyle, mental well-being, disease prevention, complementing conventional medicine. But successful integration isn't easy. It needs cohesive models, standard guidelines, training for professionals in both systems, and good scientific research.
What are the hurdles?
Things like limited public awareness, lack of standard protocols, not enough interaction between the different types of practitioners.
What about the economics? Could mainstreaming traditional medicine like AYUSH actually save money for healthcare systems? Consumers research looked at cost effectiveness.
Potentially, yes. Mainstreaming could offer more cost-effective options, especially in places with fewer resources. By focusing on prevention and holistic care, AYUSH might reduce long-term costs for chronic diseases and expensive interventions.
But it's not free to set up, right?
Definitely not. Successful integration needs upfront investment in education, research, and building the right infrastructure to make sure it's both effective and safe.
There's often skepticism about traditional medicine. Is there any recent evidence supporting AYUSH? Consumers Research mentioned a COVID-19 study.
Yes, there was a 2022 study in India looking at AYUSH-64, a specific herbal formula for mild to moderate COVID patients at home. The findings suggested positive outcomes, faster symptom resolution, lower hospitalization rates.
That sounds promising.
It is encouraging, but it's really important to stress that more rigorous, large-scale controlled trials are needed to truly validate these findings. It's early days on that front.
How does the wider global health community view integrating personalized medicine with traditional approaches like AYUSH? Consumers Research looked at equity and cost issues.
Well, personalized medicine tailoring treatments based on genetics, etc., faces big challenges with cost and access, especially in lower-income countries. Integrating traditional systems like AYUSH could potentially offer more equitable options, often using less infrastructure and being more culturally accepted.
So it could help bridge the gap.
Possibly. But both approaches need careful policy development so they don't accidentally make health disparities worse.
What are the biggest roadblocks right now to integrating AYUSH with modern healthcare? Consumers Research highlighted recent research on this.
Key challenges include a lack of understanding and awareness of AYUSH among conventional doctors, not enough communication between the two systems, the absence of standardized protocols for many AYUSH therapies, and just a need for more solid collaborative research using modern scientific methods.
So bridging that gap requires a lot.
It really does. Supportive government policies, education for healthcare workers, fostering research partnerships, it all needs to happen.
Who can really push this forward then? Consumers Research looked at professional organizations.
Yeah, groups like the Indian Association of Preventive and Social Medicine can play a huge role. They can advocate for better regulations, help develop guidelines, encourage research and education, and boost public awareness about AYUSH's potential benefits and, importantly, its appropriate uses. Their involvement is pretty crucial.
Okay, let's turn now to a field where tech is really changing things. Healthcare. NBC News on MSN.com had the headline, "Medical errors are still harming patients. AI could help change that." We've touched on AI, but how could it specifically reduce medical errors?
Well, the headline's broad, but based on our sources today, the focus is really on a critical area, improving drug management and medication safety. That's absolutely key for patient well-being.
Right. But what are the difficulties in actually building and using these AI tools for drug management in, real hospitals and clinics? Consumers Research outlined some hurdles.
Well, there are quite a few significant challenges. Top of the list is protecting sensitive patient data. Privacy is paramount. Then there's navigating complex IP issues with the AI algorithms themselves.
And the AI getting things wrong.
Exactly. The potential for AI hallucinations generating incorrect information. Plus, integrating AI smoothly with existing medical databases, making sure the systems are fast and reliable in critical moments, and meeting all the complex regulatory standards for medical software.
Sounds like a minefield.
It is complex. Plus, the sheer computing power needed and keeping these things running long-term are big considerations too.
Despite all that, are there any promising advancements using AI for drug management? Consumers Research mentioned something for resource-limited areas.
Yes, one really encouraging development is the creation of open-source AI chatbot frameworks, like the Drug Insights Initiative.
How does that work?
It uses a technique called retrieval augmented generation. Basically, it combines local drug data with advanced AI models to give accurate, up-to-date drug info to healthcare workers in places where maybe they don't have easy access to pharmacists or comprehensive drug references.
So it could make a real difference in underserved areas.
Potentially, yes. Tools like this could significantly boost medication safety by making crucial drug information much more accessible right when and where it's needed.
Okay, let's shift gears again to something really fundamental. Food and diet. Norwich Science Report had an intriguing headline. Even less healthy plant foods help diabetics lose weight, studies show. That sounds counterintuitive.
It does, doesn't it? But the key finding from the study Consumers Research looked at was specific to people with type 1 diabetes. For them, just shifting from a diet heavy in animal products to one with more plant-based foods, even if those plant choices weren't always the healthiest, still led to weight loss.
Huh. So just eating more plants generally helped.
For this group, it seems the overall dietary pattern shift was beneficial for weight. It suggests the broader composition might be more influential than scrutinizing every single plant-based item's health score, at least for weight management in type 1 diabetes.
How do the general dietary guidelines usually describe plant-based diets for people with diabetes? Thinking about weight and blood sugar.
Generally, guidelines emphasize that a well-planned plant-based diet, rich in fiber, lower in refined carbs, can be really beneficial for both weight and blood sugar control.
Mm-hmm.
The focus is usually on cutting back on sugary, high glycemic foods and upping fiber from veggies, legumes, whole grains.
Which helps stabilize blood sugar.
Exactly, and can lower the risk of long-term diabetes complications.
If someone's thinking about this, what is a plant-based diet exactly? How is it different from vegan or vegetarian? Consumers Research clarified this.
Right. A plant-based diet just primarily emphasizes foods from plants, vegetables, fruits, whole grains, legumes, nuts, seeds. The key difference from veganism is it doesn't necessarily mean cutting out all animal products completely.
More flexible, then.
Yeah, it focuses on prioritizing plant foods and reducing animal foods. For some people, that flexibility makes it feel more sustainable.
Are there well-known diets that fit this plant-based model and are good for diabetes or weight loss? Consumers Research mentioned the Mediterranean diet.
Absolutely. The Mediterranean diet is a classic example. It's heavily plant-based and consistently linked to weight loss and better health outcomes, including for diabetes. Lots of unprocessed cereals, legumes, veggies, fruits, moderate fish and dairy, very little red meat.
And linked to lower mortality, too, right?
Yes, and lower rates of several chronic diseases. It's a well-studied pattern.
With tech everywhere, are there digital tools or expert systems to help diabetics manage a plant-based diet? Consumers Research found research on this.
Yes, recent research highlights intelligent expert systems being developed. They're designed to help diabetic patients make good food choices on a plant-based diet, especially helpful where nutrition counseling might be hard to get.
How do they work? Personalized advice.
Pretty much. They consider the patient's food preferences alongside medical guidelines to give tailored recommendations, aiming to help people stick to the diet and get better results.
Social media seems to be where many people get health info now. Consumers Research looked at how platforms like Twitter shape understanding about plant-based diets and diabetes.
Yeah, analyzing huge amounts of social media data, like millions of tweets, can give real insights into public opinions and conversations about these topics.
What can you learn from that?
You can see links people make between diet, exercise, obesity. You can spot areas of public interest or confusion. This kind of data can actually help healthcare providers and health campaigns tailor their messages better.
Okay, wrapping up on diet. What are the main pros and cons of plant-based eating for people with diabetes based on the evidence? Consumers Research summed it up.
The key pros are generally better weight management, improved blood sugar control, and reduced cardiovascular risk. The main potential con: if the diet isn't well planned, there's a risk of nutrient deficiencies, things like B12, iron, protein.
So planning is crucial.
Absolutely. Getting guidance from a doctor or dietitian is really important to make sure you're getting everything you need nutritionally.
Finally, let's loop back to where we started, that feeling about healthy food going bad fast. The Wall Street Journal and MSN.com had the headline, "The healthier the food, the faster it goes bad." Or, so people think. Seems our perception might be off.
That's right. And Consumers Research explored how this very perception influences what we actually buy when it comes to healthy foods.
So how does that belief affect our shopping carts?
Well, the idea that fresh fruits and veggies spoil quickly often makes people hesitate to buy them in larger amounts. They might go for processed foods that seem safer, shelf-stable, fearing the healthy stuff will just go to waste.
Which isn't great for healthy eating.
Not at all. And ironically, it can actually increase food waste because people might throw out perfectly good items just based on this fear perception.
What about the bigger economic picture? Does this fear of spoilage impact sales and waste? Consumers Research looked at that too.
Yeah, it has a kind of double economic whammy. Retailers might see lower sales of perishable healthy foods if consumers opt for longer lasting, maybe less healthy stuff. And at the same time, overall costs in the food system go up because more edible food gets thrown away.
So tackling these misperceptions could help, maybe with better labeling or education. We briefly touched on ingredient safety earlier. Consumers research noted AI is even being used to spot chemical contaminants in food now. It all ties into trust and understanding what's in our food and how long it lasts.
Exactly. Better information, clearer labeling it, could potentially reduce waste and encourage healthier buying, benefiting everyone.
It really is all so intricately connected. Wow, we've gone from pennies to pensions, traditional medicine to AI, diets to dodgy vegetables. Thank you for joining us for this deep dive into the latest consumer trends and news, all brought together by Consumers.app on this day, May 26th, 2025.
Indeed, it's been a truly insightful journey through the forces shaping our lives.
If you found these insights valuable, please do like and subscribe to Consumers 360 for more in-depth analyses like this one. And now, for a final thought to maybe chew on. Considering those potential savings, do you think that money could be best used to directly benefit us, the consumers? Something to ponder.